There is a moment, somewhere between desire and disappointment, when a man's body simply doesn't respond the way he expects it to. No, no obvious reason. And in that silence, a question starts to form that almost nobody says out loud. Is something wrong with me? What most people never realize is that this moment has almost nothing to do with willpower, attraction, or masculinity, and almost everything to do with a tiny gas molecule your body makes every single day, a molecule so small it can slip between cells without even needing a receptor to let it in. This is the story of how that molecule controls one of the most misunderstood processes in the human body, and how two small pills changed the way medicine treats it forever. Before we get to the pills, we have to understand the machine they were built to influence, because almost nobody actually knows how an erection happens, not really. Most people think it is purely psychological, a switch that flips on when the mind is interested. But the truth is far more mechanical, far more elegant, and far more fragile than that. It starts with a spark, some kind of sensory or mental trigger, a sight, a touch, a thought, a memory. That spark travels through the nervous system and tells specific nerve endings in the to release a chemical messenger called nitric oxide. This is the same nitric oxide your body uses to widen blood vessels during exercise, the same molecule bodybuilders talk about when they discuss blood flow and pumps at the gym. In this context, nitric oxide acts almost like a key turning in an ignition. Without it, nothing downstream happens, no matter how aroused someone feels in their mind. Once nitric oxide is released, it triggers a chain reaction inside the smooth muscle cells of the penis. It activates an enzyme that produces a second messenger called cyclic GMP, and this is where things get interesting, because cyclic GMP is the actual signal that tells the smooth muscles to relax. When those muscles relax, tiny blood vessels called the cavernosal arteries widen dramatically, sometimes increasing blood flow by more than 20 times the resting rate. Blood rushes into two spongy chambers inside the penis called the corpora cavernosa, and as they fill, they press against the surrounding veins, sealing them shut like a valve. Blood comes in freely, but it cannot leave. That trapped pressure is what creates a firm, sustained erection. It is essentially a hydraulic system, powered by chemistry, not by mood alone. But here is something most people never think about. This same system depends entirely
Your
on
body
healthy
is
blood
talking to
vessels,
you.
healthy
Are you
nerves, and a
listening?
well-regulated hormonal environment. This is exactly why erectile difficulty is now considered by many physicians to be one of the earliest visible warning signs of cardiovascular disease, sometimes appearing years before a heart attack or stroke. The blood vessels in the penis are smaller than the arteries in the heart, so when plaque or vascular damage begins to build up in the body, the smaller vessels often show the strain first. In other words, sometimes the bedroom becomes an early warning system for the heart, long before any chest pain ever appears. This single fact is why so many doctors now treat erectile concerns not just as a private issue, but as a potential clue about a man's overall health trajectory. So, turns this system off. Three things, and understanding them is key to understanding the medications that treat this condition. First, the original nervous trigger fades, meaning the initial arousal signal stops firing. Second, an enzyme in the body called phosphodiesterase type 5 begins breaking down that cyclic GMP messenger, shutting the chemical signal down piece by piece. Third, after ejaculation, the nervous system sends an entirely different signal, this time telling the smooth muscles to contract again, forcing blood back out of the penis and returning everything to its resting state. It is a beautifully timed biological loop: arousal, chemical amplification, sustained pressure, and then release. Now here is the twist that most people never expect. The very enzyme that shuts this process down, phosphodiesterase type 5, became the single most important target in modern erectile dysfunction treatment, almost entirely by accident. In the 1990s, researchers were not trying to treat erectile dysfunction at all. They were testing a new compound as a potential treatment for high blood pressure and chest pain related to poor blood flow to the heart. Volunteers in clinical trials took the medication as directed, and researchers came back to collect the pills that weren't taken, standard procedure in pharmaceutical trials. Except something strange happened. Male participants weren't returning all their unused pills, and when asked why, many hesitated to explain the very personal side effect they had started experiencing. The blood pressure benefits were underwhelming, but an entirely unexpected effect had emerged, and it would go on to reshape an entire area of medicine. That accidental discovery became sildenafil, more widely recognized under its brand name, a medication that essentially blocks phosphodiesterase type 5 from breaking down cyclic GMP, allowing the erection-sustaining signal to linger far longer than it naturally would. Understanding this mechanism actually explains almost every practical detail about how these medications behave, why timing matters, why food affects them, and why side effects happen in the first place. Because these drugs are not creating arousal out of nothing. They are amplifying and extending a signal that has to already be present. This is a crucial psychological and medical distinction that gets lost in casual conversation. These medications support and prolong a natural physiological process. They do not manufacture desire from nowhere. Arousal still has to initiate the process. The medication simply helps the body sustain what it already started. This original compound needs to be taken roughly 30 to 60 minutes before intimacy, and its effectiveness noticeably drops if it's taken on a full stomach, especially after a high-fat meal, because fat slows the rate at which the medication is absorbed into the bloodstream. Its effects generally last around 4 to 5 hours, and dosing typically ranges from 25 milligrams up to 100 milligrams depending on individual response and tolerance. It is used strictly on an as-needed basis, meaning it isn't designed for continuous daily use. A handful of years later, a second molecule entered the picture, one engineered with a different chemical structure and a much longer half-life. This compound, tadalafil, more commonly known by its brand name, works through the exact same core mechanism, blocking phosphodiesterase type 5, but it does so with far more selectivity, meaning it interacts less with other enzyme subtypes in the body. This selectivity is part of the reason certain side effects differ between the two medications. Sildenafil, for example, has a slightly higher tendency to interact with a related enzyme in the retina, which explains why some users of the original medication report a temporary blue-tinted or green-tinted change in their vision, a strange but harmless and reversible effect tied directly to how the drug interacts with light-sensing cells in the eye. Tadalafil, by contrast, remains active in the bloodstream for up to 36 hours, an almost unbelievable difference in duration. This extended window is why many people nickname it the weekend option, since a single dose taken on a Friday evening could theoretically remain effective well into Sunday. It also does not require an empty stomach, giving it a practical advantage for people whose lifestyles don't easily accommodate strict timing around meals. Beyond the on-demand version, tadalafil is also available in a much lower daily dose, taken every single day regardless of when intimacy might occur. This changes the entire psychological experience of treatment. Instead of planning a moment in advance, some men prefer the freedom of spontaneity that comes from consistent daily dosing, removing the pressure of timing altogether, which itself can reduce performance anxiety, a factor that plays a much larger role in this condition than most people acknowledge. And this is where the story becomes more interesting than a simple side-by-side comparison of two pills, because there is a hidden layer connecting this medication to an entirely different, seemingly unrelated health issue, one that affects millions of aging men worldwide, an enlarged prostate, medically known as benign prostatic hyperplasia. As men age, the prostate gland often grows larger, pressing against the urethra and making urination more difficult. Symptoms include a weaker urine stream, a sense of incomplete emptying, waking up multiple times at night to urinate, and an urgent, sometimes uncontrollable need to go. Researchers discovered that the same enzyme pathway involved in erectile function is also present in the smooth muscle tissue of the bladder and prostate. This means the daily low-dose version of tadalafil doesn't just support erectile function, it can simultaneously ease urinary symptoms linked to prostate enlargement, essentially treating two connected conditions with a single mechanism. For a man dealing with both issues at once, something incredibly common in men over 50, this dual benefit can be a genuinely life-improving discovery, not just a convenience. Of course, no honest conversation about medication is complete without addressing risk. Because these are not harmless lifestyle pills, they are pharmacologically active compounds that interact with the cardiovascular system, in a very specific and potentially dangerous way. The single most critical warning tied to every phosphodiesterase type 5 inhibitor involves a class of medications called nitrates, commonly prescribed for chest pain or angina, often taken as a small tablet placed under the tongue. Nitrates work by dramatically increasing nitric oxide activity throughout the body's blood vessels, and if combined with a medication that is already prolonging the effects of that same signaling pathway, blood pressure can plummet to dangerously low levels within minutes. This combination has been linked to severe, life-threatening drops in blood pressure, and in some documented cases, death. This is precisely why medical guidelines are unusually strict here, and why anyone on nitrate therapy is instructed never to combine it with these medications under any circumstance, regardless of how the situation feels in the moment. Beyond that critical interaction, there are more common and far less dangerous side effects that still deserve honest acknowledgement. Headaches are frequently reported, largely because of the widespread vasodilation, the widening of blood vessels, happening throughout the body, not just locally. Flushing, a warm reddening of the skin, occurs for the same reason. Nasal congestion
Look at
and
the
mild
systolic
heartburn
readings
are
here.
also
The
common
stabilization
complaints,
after dosage is
tied to the
significant.
relaxation
Yes, confirmed
of
on the
smooth
monitor.
muscle tissue
I'll make
in
a
the
note for the
nasal
next trial.
passages and digestive tract. Tadalafil users report muscle aches and back pain slightly more often than sildenafil users, an effect researchers believe relates to how the drug interacts with muscle tissue throughout the body over its much longer duration of action. There are two rare but serious risks worth understanding, not to create fear, but to promote awareness and safety. The first is a condition called priapism, an erection that persists for longer than 4 hours without any ongoing
That's it.
stimulation.
The coating
This isn't
reacts
a
to the
bonus
light.
or an
We need
achievement,
opaque
It is
bottles.
a medical emergency. When blood remains trapped in penile tissue for too long without proper circulation, oxygen deprivation can begin causing permanent damage to the delicate tissue involved, and if left untreated, it can result in lasting impairment. This condition is exceedingly rare when medications are used exactly as prescribed and becomes far more likely with misuse, overdosing, or combining substances inappropriately, which is precisely why medical supervision matters so much here. The second rare risk involves sudden hearing loss, a reported but very uncommon side effect whose underlying mechanism researchers are still studying, believed to relate to how these medications affect blood flow to the delicate structures of the inner ear. Now, the question everyone eventually asks, which one is actually better? Fortunately, this isn't just guesswork or brand loyalty, because researchers have compared these medications directly using large-scale analyses that combine data from thousands of patients across multiple studies. One particularly comprehensive review pooled data from 16 separate clinical studies involving more than 5,000 participants, using standardized, scientifically validated questionnaires rather than vague self-reported impressions. The overall efficacy between the two medications turned out to be remarkably similar, both improving erectile function in roughly the same percentage of users. But when researchers dug deeper into patient satisfaction, partner-reported satisfaction, and long-term adherence, meaning how consistently people continued using the treatment over time, Tadalafil edged ahead. Multiple studies within that analysis found that both patients and their partners tended to prefer Tadalafil when given a direct choice between the two, largely attributed to its longer window of effectiveness and lower dependency on strict timing around meals. Interestingly, self-reported confidence and relationship satisfaction scores were also slightly higher among Tadalafil users, a finding researchers linked to reduced performance pressure created by that extended, more flexible timeframe. Choosing between these two options ultimately comes down to lifestyle far more than raw effectiveness. Someone who prefers structure, plans intimacy in advance, and doesn't mind timing meals around medication might do perfectly well with the shorter-acting original option. Someone whose life is spontaneous, unpredictable, or who values not thinking about timing at all might find the extended action option far more compatible with daily life. And for men experiencing both urinary symptoms tied to prostate enlargement and erectile difficulty simultaneously, the daily low-dose approach offers a uniquely efficient, dual-purpose solution worth discussing directly with a physician. It's also worth mentioning, briefly and honestly, that medication is not the only avenue available for treating this condition, and it certainly isn't always the first step recommended. Lifestyle factors play an enormous, often underestimated role. Cardiovascular exercise improves blood vessel health system-wide, directly supporting the very circulation this entire process depends on. Chronic stress elevates cortisol, which can interfere with the hormonal balance required for healthy arousal signaling. Sleep quality, alcohol consumption, smoking status, and even mental health conditions like anxiety and depression all measurably influence how well this biological system performs. This is why a responsible, thorough medical evaluation looks at the whole picture, not just the immediate symptom. Because sometimes the underlying cause is something entirely separate from the reproductive system altogether, something hiding in blood sugar levels, thyroid function, testosterone levels, or even undiagnosed sleep apnea. For situations where oral medications aren't suitable, whether due to nitrate use, other medical contraindications, or simply personal preference, there are several alternative pathways worth knowing about, even briefly. There are urethral suppositories that deliver medication directly rather than through the bloodstream. There are injectable treatments administered directly into penile tissue, offering a different route of action for men who don't respond to oral options. There are vacuum erection devices that create mechanical negative pressure to draw blood into the tissue externally, entirely bypassing the chemical pathway altogether. And for select cases, there are surgically implanted devices designed for long-term, reliable use. Each of these options exists because human physiology is wonderfully varied, and no single treatment works universally for every person, every condition, or every underlying cause. What makes this entire topic worth understanding isn't just the pharmacology, it's what it reveals about how the body works as an interconnected system rather than a collection of isolated parts. A moment that feels deeply personal, even embarrassing for many men to discuss, is actually the visible surface of an intricate biological process involving the brain, the nervous system, hormone signaling, and the cardiovascular system all working in concert. When that process falters, it is rarely a reflection of character, attraction, or worth, and far more often a signal, sometimes the earliest one available, that something deeper in the body deserves attention. Understanding the science behind it strips away the shame that so often surrounds this conversation and replaces it with something far more useful: knowledge, context, and the confidence to seek proper medical guidance rather than silent avoidance. Perhaps the most valuable takeaway here isn't about choosing one medication over another at all. It's the realization that the body is constantly communicating with us in small, specific signals, and learning to interpret those signals, rather than ignoring or fearing them, is one of the most powerful forms of self-awareness a person can develop. The next time something in your body doesn't work quite the way you expect, consider that might not be a failure at all, but a message quietly asking you to pay a little closer attention to the system underneath it.